This is Selma Schimmel for the Group Room at the annual San Antonio Breast Cancer Symposium, joined now by Dr. Julie Gralow, the Jill Bennett Professor and Director of Breast Medical Oncology at the University of Washington and the Seattle Cancer Alliance, also a member of the Fred Hutchinson Cancer Research Center. Hello, Dr. Gralow.
Hi, Selma.
Cognitive problems. There's some data being presented here. I have some issue with it. I want to hear what you have to say. It may be present before chemotherapy in women with breast cancer. So I'm going to hold my thought till I hear what you have to say about this study.
I'd like to hear what you think. So this was a study of women who were newly diagnosed with breast cancer but hadn't yet had their treatment. So they hadn't yet started chemo, they hadn't yet started radiation, and there was a control group of women who weren't diagnosed with cancer, who were kind of matched by age. So before they started their chemo or radiation, they had some fancy MRI scans that looked at some brain function. They had, testing of cognition, memory, skills, etc. And then they tested them again after they had gotten their therapy. So this study that's about to be presented showed that a lot of women already had cognitive issues before they started their treatment. And the suggestion I've heard at this meeting is maybe we shouldn't call it chemo brain anymore, but we should call it cancer brain. Something about the cancer diagnosis and the fear and the panic and the knowing that you're going to start a toxic therapy could impact your cognition. So radiation, knowing you were going to start radiation, but not getting chemo, actually caused less cognitive effect. So it's not all about the cancer diagnosis. It's also somewhat potentially about the anticipation of what you're going to get, or it's a tough one, or maybe it's that women who have chemo recommended just in general have a different stage of disease or other things going on. So I'd be interested to hear what you think. I think that we can't blame our therapies 100%, is I think what the conclusion is, that the diagnosis in and of itself is
It's very
already
stressful.
Yep.
And I mean, quite frankly, a diagnosis of cancer will lead to sleep dysfunction.
Right.
And enormous stress.
Absolutely.
And if you couple all those things, it is no wonder that someone will have memory issues. And yes, if you already have stress in your life, you may already be suffering some of these things. But there was just sort of this feeling of, well, first of all, it was to me a no-brainer, no pun intended, but it's like, well, what do you expect? You are going to be anyone, and I don't care if it's a woman or a man, or any kind of illness. The onset of anything severe in your life could already cause all of this.
Right.
And I don't know, it just gave me the feeling a little bit of, blaming the victim. It felt like somewhat of a judgment, and I could have sort of read it wrong or read into it the wrong way, but I just think any cancer patient, we have to cut them quite a bit of slack for the impact and the disruption of the routine of life. And when your life is disrupted in that way, and you're really stressed out, and you're not sleeping right, that independent of the reaction to chemotherapy or any therapy, life becomes crazy, and you are going to lose your focus, and it's going to maybe cause cognitive dysfunction.
Well, I think it's interesting that you felt the sense that it was blaming the patient. I would entirely blame the cancer. You know what my take home from this was, Selma, that actually might shape the way I address this, is that when my patients are getting chemo and they are fatigued and they tell me that they're having chemo brain, a lot of times I empathize and I say, I know it's hard and, everybody goes through this and it will get a lot better. But knowing that a lot of this is already present before they even start the chemo. And I agree with you, the anxiety and the depression and the insomnia and all, it might make me more inclined to really refer to psych, maybe for some mind-body help, or to really work harder on the insomnia piece and all, and say, not just say, oh yeah, everybody has it, you know, and so just kind of say it'll get better, and maybe work harder on some of the mind-body pieces to try to make it better even when they're on the chemo.
And there's this other element, though, and that is you never know. Everyone has baggage, but you never really know what someone is carrying in their bag. And so if someone, let's say, is a single mom and is stressing over money and doesn't have support to help with her child, she's going to have a unique set of stressors.
Absolutely.
If someone is running a business and they are responsible for the salaries of a lot of other people, and they're not able to maybe maintain all of their obligations professionally, that's going to be a huge stressor. And so I guess that feeling of blaming the victim part came from me thinking back, sort of wondering, well, what's going on in individual lives beyond the obvious of, wow, it's really stressful and life disruptive to get a diagnosis. But when you compound that with, what are all the other factors that make this person unique? What's influencing this person? Because, oh, when you leave your doctor's office, the doctor may not realize that his or her patient is going home and going to be working for 3 days against a project deadline. Mm-hmm. And I think it's the struggle for patients to figure out how to integrate their lives, real life that goes on independent of the cancer, on top of the cancer. It's not like the luxury of, okay, well, now I have cancer, so I'm just going to turn off that part of my life and I'm only going to focus on healing, and I'll have the stress of my disease, but I'm just going to clear all the rest away because it doesn't apply now. No, not only does it apply, it gets even harder to keep up with it. So you may also not be sleeping because you're working against other issues in your life that require your attention.
So you bring up really important point, Selma, and I still would go back to saying that if you've got a stressful life, which many of us do, cancer can just push you over the edge. And you're right, in studies like these, we do need to understand all of the background issues of the patient as well.
Thank you, Dr. Gralow. Mm-hmm. I love our overviews with you. You touch on so many important things, and your research, awfully important.
Thanks for having me, Selma, and thanks for everything that you do for all of your viewers.
Dr. Julie Gralow, the Jill Bennett Professor and Director of Breast Medical Oncology at the University of Washington and the Seattle Cancer Care Alliance, also a member of the Fred Hutchinson Cancer Research Center. Thanks again, Dr. Gralow.
Thanks, Selma.